Xoten Lotion is used to relieve minor aches and pains in the muscles and joints, such as arthritis, backache, and sprains. It contains menthol and methyl salicylate, which are known as counterirritants. These ingredients work by creating a cooling and warming sensation on the skin, which helps distract from the deeper aches and pains in the muscles, joints, and tendons. It's important to note that this product should not be used on children younger than 12 years old without a doctor's advice. If you plan to use it on children between 2 and 12 years old, be sure to carefully check the label. And remember, it should never be used on children younger than 2 years old. When using Xoten Lotion, it's important to follow the directions on the product package. If you have any questions, be sure to ask your doctor or pharmacist for guidance. This medication is meant for use on the skin only, and should not be applied near the eyes, mouth, nose, or genitals. If the medication does come into contact with these areas, make sure to flush with plenty of water. It's also important to wash your hands well before inserting contact lenses. If you are using the lotion, spray, or foam, be sure to shake the bottle well before using. Apply a thin layer of the medication to the affected area no more than 3 to 4 times a day, rubbing it in gently and thoroughly. After applying the medication, wash your hands unless you are using this medication to treat the hands. If treating the hands, wait at least 30 minutes before washing your hands. It's important not to apply this medication to skin that is injured or irritated, such as cut, scraped, or sunburned skin. Avoid bandaging or tightly wrapping the affected area, as this may increase the risk of side effects. You may cover the area loosely to protect clothing, but be sure to ask your pharmacist for more details. Heat can also increase the risk of side effects, so it's best to avoid applying this medication immediately before, during, or after activities that increase skin temperature, such as bathing in hot water, swimming, or heavy exercise. Wait until your skin has cooled before applying the medication. Additionally, avoid using a sun lamp/tanning bed, hot water bottle, or heating pad on the treated area. It's important to note that this product is available in different strengths and with different ingredients, but with product names that sound similar. Be sure to read the label carefully to make sure you have the right product for you, and ask your pharmacist if you have any questions. If your condition lasts for more than 7 days, gets worse, or keeps returning, be sure to tell your doctor. And if you think you may have a serious medical problem, seek medical help right away. If you experience redness, warmth, stinging, or burning on the application site, it's important to talk to your doctor or pharmacist. It's important to note that your doctor has determined that the benefits of using this medication outweigh the potential side effects. Most people who use this medication do not experience serious side effects. However, if you notice blistering, swelling, severe redness, increased pain at the application site, nausea, vomiting, ringing in the ears, or any signs of a serious allergic reaction such as rash, itching, swelling, severe dizziness, or trouble breathing, it's important to stop using the lotion and seek medical attention immediately. Remember, this is not a complete list of possible side effects, so it's important to talk to your doctor or pharmacist if you notice any other effects. Before using Xoten Lotion, make sure to inform your doctor or pharmacist if you have any allergies to menthol, methyl salicylate, aspirin, or other salicylates. Also, be sure to talk to your pharmacist about any inactive ingredients that may cause allergic reactions. If you have asthma or nasal polyps, it's important to consult with your doctor or pharmacist before using this product. And if you have any upcoming surgery, be sure to inform your doctor or dentist about all the products you are using. Xoten Lotion contains a substance similar to aspirin, so it is not recommended for children and teenagers younger than 18 years if they have chickenpox, flu, undiagnosed illness, or have recently received a vaccine. Using aspirin or aspirin-like products in these cases can increase the risk of Reye's syndrome, a rare but serious illness. If you are pregnant or planning to become pregnant, discuss with your doctor about the potential harm this medication may have on an unborn baby and during labor and delivery. It is not recommended for use in pregnancy from 20 weeks until delivery, and if you need to use it between 20 and 30 weeks of pregnancy, the lowest effective dose for the shortest possible time should be used. It's also important to note that it is unknown if this product passes into breast milk, so consult your doctor before breastfeeding. It's important to be aware of potential interactions with other medications, as they can affect how Xoten Lotion works and may increase the risk of serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Always consult with your doctor before starting, stopping, or changing the dosage of any medicines. If this medication is accidentally ingested, it can be harmful. In case of an overdose with severe symptoms like loss of consciousness or difficulty breathing, it is important to seek immediate medical attention by calling 911. Otherwise, contact a poison control center right away. U.S. residents can reach out to their local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center. Now, let's talk about the uses of Xoten Lotion. This medication is used to treat certain skin conditions such as eczema and dermatitis. It helps to relieve itching, redness, and swelling of the skin. The lotion should be applied to the affected area as directed by your doctor. It is important to follow the dosage and application instructions provided by your healthcare professional. As for the optimal timing, Xoten Lotion is typically applied once or twice daily, or as directed by your doctor. Be sure to wash your hands before and after applying the lotion to avoid spreading it to other areas of the skin. Make sure to keep all your medical appointments and appointments for lab tests while using Xoten Lotion. This will help your healthcare provider monitor your progress and make any necessary adjustments to your treatment plan. If you forget to apply Xoten Lotion, apply it as soon as you remember. If it's almost time for your next application, then skip the missed dose and continue with your regular schedule. Do not apply double the amount to make up for the missed dose. When it comes to storing Xoten Lotion, it's important to check the product package for specific instructions. You can also ask your pharmacist for guidance on the best way to store your particular brand. It's crucial to keep all medications out of reach of children and pets to prevent any accidents. When it comes to getting rid of expired or unused Xoten Lotion, it's important to do so properly. Instead of flushing it down the toilet or pouring it into a drain, you should consult your pharmacist or local waste disposal company for the best way to discard it. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.